Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Molly Mraz, Public Information Officer for the Harford County Health Department and your host for today's Public Health Matters. It's the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. The Klein Family Harford Crisis Center is the first co-funded public and private partnership in Maryland to offer 24/7 behavioral, mental, and addiction health services. Joining me today is Rod Kornrumpf, Executive Director for Behavioral Health for University of Maryland Upper Chesapeake Health, and Pam Llewellyn, Regional Director for Behavioral Health and the Director of the Klein Family Harford Crisis Center. Thank you so much for being here today.
Thanks for having us.
This is such a big deal.
Yes.
In Harford County. So can we just talk about what exactly the Crisis Center is, but really why this is such an important center to have in Harford County?
Sure. I mean, we probably really ought to start with the why first.
Yes.
And so I think fundamentally, if we think of hospitals and emergency rooms throughout the history of time in this country, we have said to everybody, if you don't know what to do, go to the emergency room or go to the hospital. And that's good if you have a heart attack or a stroke or really a life-threatening kind of situation. Where it kind of becomes more difficult is if you are not in that acuity. And so what we wanted to do with behavioral health, so mental illness and substance use issues or both at the same time, was create an alternative to that setting. Because if you're not in a life-threatening situation, and the vast majority of people who have behavioral health issues aren't in a life-threatening situation, let's keep them out of that deep end service. Let's really provide a service that is appropriate to their needs. And so the crisis center concept was, if you don't know where to go, if you don't know what to do, if you are depressed, if you're feeling blue, if you just don't know what you're feeling, come here, let us help you sort it out. Then we can figure out if you need that higher end service, or we can keep you in that crisis center service array. The concept, again, is sort of marrying what we've seen in physical urgent care that has really cropped up around the country, where somebody with a sinus infection or a small cut that just needs a few stitches or an x-ray, they don't need to go to the emergency room. Same thing applies for behavioral health. If you don't have that life-threatening situation, come to us. We can help you sort it out. We can help you get the care you need.
I think it's also important to note that we call it a crisis center, but really the goal is to have people have the right care offered at the right time in the right environment. So if you're starting to feel some symptoms of depression or anxiety or any addiction issues, don't wait till it's a crisis to come in. We're there around the clock, 24/7, holidays, weekends. We're always there to help. So come in when you're just starting to feel that discomfort, when you're just starting to experience those symptoms, and let us help you get that help early.
And we can even back up one step.
Yeah.
Truly one step. Back in October, the county, through some funding from the state and through county dollars, created a 1-800 number, a crisis hotline. Even more important, if you don't know who to call or where to go, call that number. And behavioral health professionals on the end of that telephone line, 24/7, 1-800 next step, can help you sort that out. They can say, oh, well, maybe we can just get you an outpatient appointment tomorrow or next week, whatever is important to them. Or go to the crisis center. Go over there and they'll help you sort it out. But at that 1-800 is really the first step to anything you need. Because not just in Harford County, but really across the country, the system is still fairly fractured and people don't know who to call. They don't know, they look in the phone book, for those that remember what phone books were, or they go online and they try to find information and it's not very helpful. So the county decided in this partnership to say, let's make it easy. Just call this 1-800 next step and we'll help you sort it out. So you don't have to search. You don't have to make 20 calls to get no answers or get voicemails. Right. And so I think that really is the first true step, is that 1-800 next step number. And then we can also serve as a walk-in for any other questions or any other needs.
I think it's funny because we talk a lot about this whole concept of not being able to navigate the healthcare system. It's such a huge thing that I hear when I talk to groups and folks. And we always joke about sitting around a large table with a lot of providers, and we will say, we're looking for somebody who can take children or adolescents or with this condition, and somebody at the other end of the room will say, we do that, we can get them in tomorrow, and we will have not known that they were even in our community available and ready to take folks. And that just happens so much in this realm. So that 1-800-NEXT-STEP number is part of their response to the community, is to navigate that, to keep those databases, to know who's taking what, and where to send people for the best and right care.
And the really cool thing is the 1-800 number is in the same building as the rest of the crisis center services. So we can walk down the hall and talk to each other. We can help figure out any difficult sort of cases together in partnership, as opposed to, from a distance.
Right. And that's really helpful, that you can kind of triage those situations, because say, you were just kind of feeling blue, or you were feeling really anxious to even get an appointment with maybe like a private provider, you tend to wait a little bit longer, whereas you could be seen 24/7. I mean, 3 o'clock in the morning you wake up, you can go in and be provided with some resources there.
I think the average wait time for a prescribing provider, when I say that, that's the folks who can do a medication evaluation for you if that's needed. In the community, it's about 2 to 3+ months to get in to see somebody. And a therapist, a psychotherapist, a talk therapist, even that can be several weeks to a month or two. So what we hope to do is to really be able to give that immediate access to care. And by offering it, like you said, 24/7, it can be any time of day or night for folks.
And we put an outpatient clinic within the crisis center. Okay, so the crisis center is really a building, if you will. Within it are these array of services. One is an outpatient clinic, so that if somebody needs an appointment, and it's going to take 1 or 2 or 3 months to get to an appointment in the community, we can be that bridge appointment. We can serve their bridge needs, keep them successful in the community before they get to that longer-term therapy or longer-term medication management appointment, so that folks have access and they can be really kept successful in the community prior to that longer-term array. So it really is, the goal is to fill all the gaps, in as many gaps as we can in the system, for the people of Harford County and surrounding areas, so that they do have access to service when they need it. And as Pam said, it really is, what is it that the community needs, and how can we start filling those gaps? And I think the 1-800 number, the group that runs the 1-800-NEXT-STEP, affiliated Sante, they also provide mobile crisis services in the community. So they can send a team out to somebody's home where there is a crisis, and try to move them to where they need to be. So this is really, we call it in the business a continuum of care, so that we are taking the gaps out of the system and really filling all of the needs that somebody might bring to the table.
One very interesting statistic, we've been open in that walk-in center about 6 months, a little over 6 months, and one interesting statistic is about 68% of individuals who have accessed our walk-in services don't have any prior behavioral health, mental health, addiction care that we are aware of in our system, which means that there are a catchment of individuals who wouldn't otherwise maybe seek care unless there was an avenue like this as that first touch point. So that's telling too. So we're really trying to offer services to people who have never bridged that care, don't know where to go, don't know what to do first. And that's where we can be very helpful.
And we've had a lot of stories. And we've had a lot of stories, anecdotal stories, individuals who would say, I'm not going to the hospital, I'm not going to the emergency room, I hate to park there, I hate to wait for 3 or 4 or 12 hours to be seen. And once we opened the crisis center, they would come in and say, you've saved my life. You really gave me something that I never thought I would have access to. And perfect. That's exactly what we were trying to do, was fill a gap that was unfilled in this marketplace. And we're starting to see this kind of model pop up across the country. Certainly in this area, this is, you talked about it at the intro, the first partnered sort of project around this. Oftentimes, A county will start it, a hospital will start it, but what we really were focused on, and our community partners, the county, was to really do this together so that it is not the responsibility of any one entity, it is the responsibility of the community to take care of the community, to provide the services to the community so that we're all in it together trying to work through the problems of the entire county.
Right. How did you determine that this was something that Harford County needed?
Well, I don't think it's a secret that really nationally, but even locally, Harford County has statistics that are worse than the state in terms of suicide, substance use, overdose, and overdose deaths. So a couple of years ago, some individuals came together and said, where are these gaps? What are we missing? And what can we do? And out of that birthed the idea of we need a partnered approach to this real epidemic. And so the concept of we need help care navigating, we need immediate access to care, we need an alternative to the ED. All these ideas started to come to fruition over those next several years as we really talked to the county, talked to the community, met with groups, met with individuals and agencies, and said, what can we do, and what's the best course of action? So that's kind of really how it birthed. Yeah.
And we visited some locations where this has started to mature a little bit, Arizona, New Mexico, and really wanted to fine tune it so that it was appropriate to this area, to Harford County. And so while we've talked about the walk-in urgent care, we've talked about the outpatient, we also have 8 residential crisis beds. And that is for individuals predominantly who need a longer stabilization. It's not just they walk into the urgent care kind of component of it and leave after 3 or 4 or 5 hours. There are some number that need a day or two. They need to get new medications or back on their medications, stabilize on those, make sure the dosage is right. So we wanted to add these residential beds so that we had that opportunity. Rather than give somebody a prescription and send them home and hope it works, which is sort of what emergency rooms will tend to do, and I don't want to criticize emergency rooms. They are fabulous for what they do. But what we wanted to do was say, okay, here's a medication, here's a dosage, let's watch you for a while. Let's watch you for a day or two and make sure the dosage is right, the medication's right, you tolerate it right, we can get you access to that medication in the community so that our discharge back to home or back into the community has a better chance of success. Too often what we see is somebody gets discharged from an emergency room or from a 23-hour crisis program in some other state, and they go home and they just keep repeating the cycle because they are not comfortable with getting their medications or taking the medications, they don't like the side effects, and we wanted to take and get as best chance of success out of our system. So once they did get discharged, that we have a comfort level that A, they can come back to us if they need to, B, they can be successful in the community for the long term and manage it with their primary care physician or with their family or those sorts of things. And so that was really the goal, was to make it, again, in this continuum conversation, raise the chances of success for them.
Right. So it sounds like there's been a lot of preparation, identification of the problem, kind of adjusting, like you said, your model for Harford County residents and the community. What, when you talk about the crisis, you briefly touched upon what a crisis could be considered, but when people think of the word crisis, probably an array of emotions come to mind and an idea of what exactly a crisis is. So do you want to expand upon what exactly a crisis would be considered?
Right, so I'll give you the behavioral health answer, which is it depends. Some people, their threshold for distress is very high, meaning that they sort of live at a baseline of having depression or anxiety as a normal course of their life. And for them, that's not a crisis. That's just kind of their baseline and how they operate. But there may be times when that person is feeling particularly depressed or particularly anxious. So whatever your particular baseline is, if you're starting to feel like those symptoms are not leveling out, that your ability to implement tools, to feel resilient, to bounce back, to have a moment of just kind of emotional leveling, those are the sorts of I guess, yellow flags that maybe it's time to get some help. That having been said, the statistic shows 1 in 5 individuals will have a mental health condition of their life. I would argue everybody at some point in their life will have some mental health condition that they are going to have to address. And less than half of those individuals that have an identified mental health condition ever seek help from a behavioral health professional. Most of them go to their primary care. So we are also in the primary care offices trying to get them comfortable with assessing for these things too. And it's different for everybody, but if you go to your primary care today, they're going to ask you these questions because the threshold for distress is different for everybody. So I wouldn't put a definitive measure on what's a crisis, what's not. I would say just get the help that you need in that moment that you need it. A lot of people reach out to family, friends, trusted individuals, mentors, the faith community, because they're very easy to access. The mental health system has not been easy to access. Now we are. So my pitch to everyone is don't sit alone in this. All of us experience this. Reach out and get help. There is help. There's good help, and you don't have to live with the symptoms you're experiencing long term.
Right, and there's such a stigma still with receiving and seeking mental health help. And like you said, people with a higher threshold, they could have been living in a depressive mood their whole life and then never really identifying that until it might have been to the point where they just can't handle that anymore. And then, coming to the crisis center, you just feel such a relief. You feel like there's kind of hope for you in the future and that you can live a happier, healthier life.
It's behavioral health professionals, so they speak the language. They know from whence you came. Been there, done that with throughout most of their career. So they speak the language that's important to that individual. And you're right, there are lots of people that have lived in silence or lived in agony in silence for a very, very long time. What has been interesting, and we're starting to see it more in Harford County, but we're starting to see it across the country, is the stigma is less and less all the time. It used to be, I would go out and give speeches or meet with public groups and say, how many people have had a mental health issue, right? And I would get one hand and it would sort of be a real short rise. Now what we do is we go out and say, how many people have somebody they know who has cancer, right? Or COPD, congestive pulmonary disease. And everybody raised their hand, right? But even for somebody with cancer in recovery or in remission, they and their family often live with that cloud of, is it coming back? And if it comes back, how's it coming back? COPD, and I have an oxygen tank. Is it going to get filled when I need it to get filled? Is it going to run out in a power outage overnight? Depression, anxiety. So although our physical symptoms also often come with a behavioral health, a mental health, or a substance use comorbidity is, the nice fancy phrase we give it, but really people are living with it, and what we're trying to do is take that stigma out because we are part of physical medicine, a different specialty within it, but we are part of it, and the vast majority of people in our communities live with some form of behavioral health issue for often most of their life. And again, we wanted to make it as easy and as accessible as we could for people that have those needs. I want to circle back just briefly though and talk about we can't solve everything, right? Because we put the name like crisis center on it, and that's important. At the same time, there are people that will need an emergency room, right? Somebody who has had an overdose with a substance or is in active withdrawal from a substance. That needs a medical attention. That is not our cup of tea. And so we will send somebody to the emergency room. We've had lots of people come in with physical issues that needed emergency room attention or in the beginning stages of withdrawal, and we'll get them over to the emergency room. What we hope to be, what we're setting ourselves out to be, is that sort of first step. The 1-800 next step is the true first step, the walk-in crisis is the second step, and then let us figure out where they need to go next for their next level of care.
It's interesting because I hear in the community everybody talk about why is mental health and addiction so prevalent? I'm seeing it everywhere, and it can really make people feel hopeless. But I think there's another side to that coin. Yes, I sense that the general wellness and perceived wellness of our population, our community, has decreased over time. That also because we're more aware of these issues. And because we're more aware and it's getting so much attention and you're hearing about it so much, there's more resources being wrapped around it. There's more funding being poured into it. So in talking about stigma, that really helps to reduce the stigma so people can feel free to get the help that they need. So yes, you're hearing a lot more about it, but it also means that resources and opportunities for improvement come along with that.
Right,
It's not
which
all
is
bad.
a good thing.
Right.
Right,
Yeah.
exactly. So do you see a certain age group? I mean, let's talk about demographically who you would see. You know, is there a certain age group that you see, a certain population that you would see?
Our walk-in, anybody can come to the walk-in. There's really no age limit. I think the youngest we've seen is, I want to say
5, I think.
5 or 6 years old, in context of a family support need. So there were
Right.
other siblings and parents involved in that. And the oldest, I think, so far is 87 or 88 years old. So age does not matter. What is going on does not matter. Just come in and let us help you. Figure all of that out.
And we have access. The reason that the 1-800 number was created was to create this repository of all the services, or as many services as possible, that they could pull together within the county or within the region. So again, if somebody comes in and it's a 5-year-old, and that's not necessarily our expertise, we
Right.
can assess, we can help then access those services that are available to them that are most appropriate to that need anywhere in the region. And so tying this all together makes the age sort of irrelevant to us, right? It's sort of agnostic to us. Just come in and we can help you find the next step.
And
Right.
one of the incredible things about having this robust public-private partnership is those connections with resources.
Right.
So we are able to get people into the health department services. They have a full array of not just behavioral health, but all kinds of services we can link folks with. Ashley Addiction is also partnered with us. They're going to be co-located at the site in Bel Air. Who am I missing? Addiction Connection Resources. I mean, there's all of these agencies that are partnering with us that now we have, everybody has tentacles that reach each other.
Right.
So it's easy access.
Which
So-
is most important, I think, and because if you the resources to come together, because then you can navigate the system a little bit better.
Right. And we can make it easy to navigate the
Right.
system. The health system as a whole is just generally
Yeah.
not easy to navigate.
Right.
That's why everybody created 911 and emergency rooms, right?
Right.
Because it's hard to navigate, just come there, let them figure it out. What we're saying is let's go further upstream, especially around mental health and substance use. If you don't know where to go, call and come to us, and we can help you navigate that system because it can be very difficult, especially if you truly are in a crisis. You know, where to turn very quickly, and let us help you do that.
Yeah. And how scary, I mean, the parents of the children at such a young age,
Right.
because it might just be, it might be they're newer to, parenting in general and how to help their child. I mean, you just kind of feel helpless in general.
But that also speaks to an incredible innate strength of parents, that they would take that initiative to get the help that their child needs.
Right.
That, and being a parent myself, that takes an incredible amount of humility and really love and care for your child. So that's the first thing we see when parents come with children, is just recognizing that for the parents and validating, listen, it doesn't matter the way you feel. Feelings can fluctuate. You're here and we're going to help you, and just validating and kind of normalizing their experience as a parent
Right.
is important.
Right. Because you'd hate for that parent to ignore it.
Right.
Or just think,
Right.
oh,
It's the terrible twos.
Right.
I
Right,
know,
right.
I know.
Right.
And then something, terrible could happen.
And often, because now there are services, more and more services in schools, it's being
Yes.
identified much earlier in the illness array. Again, historically, a child falls off a bed and gets a bloody nose, you know what to do there, right? You
Right.
call the doctor, you call the pediatrician, you take them to the emergency room, or take them to urgent care. Behavioral health kind of stuff is a little more subtle.
Yeah.
And so you really have to pay attention to, this is sort of a theme. This is
Right.
now not just a one-off. This is going on now for months or weeks, whatever it is.
Right.
And so I think it's important for the parent to recognize it, have the strength to say, there might be something more here that we can't handle.
Right.
And that is hard for parents to sort of tolerate.
Yeah.
But then let us help you.
Right. And then, so just kind of like the nitty gritty, insurance. Does the Crisis Center take insurance?
Yeah, we are paneled with most commercials, Medicaid, Medicare.
Okay.
We can also help you navigate those waters. We have a population of folks who have no insurance, are uninsured, are underinsured. So we also have a health department employee on site who can help link people with the Maryland Medicaid program if that's indicated. And we have that ability to work with folks. So.
And I want to, so insurance, no insurance, doesn't matter.
Doesn't matter.
Doesn't matter.
Doesn't matter.
We'll help you
Anybody
sort
can
it
go.
out.
Yep. And what about transportation if you don't have means to get there?
So, that gets a little trickier in terms of like bus routes, because we're not quite on the bus route in Harford
Yeah.
County. We're a mile away. That said, we've worked with the transportation department in the county to say if somebody is at the Harford Mall, which is a mile away from our location,
Right.
they can make a call to, and I don't even know the number, but they can make a call and get a van to transport from that location to our site. But we can take an Uber, we can take,
Right.
a Lyft can bring somebody, a cab can bring somebody. So there's all kinds of stuff that's available today that wasn't available 10 years ago.
Yeah.
That can make it easier for somebody to get from point A to point B. Again, if they call the 1-800 number, the 1-800 next step, and say, I'm here, but I don't have transportation, that team can help get an Uber or a cab or whatever is an appropriate transportation for that person. So they're not alone having to try to figure out how to get from point A to point B. They can get help right away with the 1-800 number, or they can call our service, doesn't matter.
Right. That sounds like no matter what,
Right.
no matter what, you are always there and can provide support and triage the
Right.
the patients.
Right.
So let's talk about where it's located, because that's important. People need to know where they can.
So we are located at 802 Baltimore Pike in Bel Air. It's less than a mile from Upper Chesapeake Medical Center. It's off Business Route 1. So it's really close and convenient. And speaking of transportation, there is a bus stop at the mall, and we are maybe a quarter mile up the road. So we do have some folks that take the bus and walk up to us.
Okay.
And this may be a little granular, but just for folks that come into the walk-in service, we do have nursing there 24/7 and licensed counselors there 24/7. And then
Okay.
after those assessments are done, we get them to where they need to go from there.
Okay. And so again, the location, kind of like across from Wawa, kind of there used to be a bowling
Right.
alley.
Bowling alley,
Used to be
yeah.
For
bowling
those
alley.
people
Used to
who
be the
have been
auto
around
auction
here for a long time.
headquarters,
Right.
used to be
Exactly.
Gold's Gym, those are all the phrases.
Yes.
Retro Fitness is still in the same building that we're in.
Yes.
So, those are sort of the landmarks.
Right.
And even some GPS systems, 802 Baltimore Pike works for some,
Yes.
802 Bel Air Road works for others.
Okay.
Baltimore Pike and Bel Air Road essentially are the same.
Right.
They just-
Do you have people from Baltimore County? I mean, do you have to be a
Yes.
Harford County resident
No.
to be able to
Nope.
walk in?
Not to walk in. No.
Okay.
The mobile crisis team, that phone number 1-800 next step, if you call and need a mobile person, that's by county, but they will help connect you with whatever county you're in. So always call. You don't have to live in Harford County to access
We've
us.
had Pennsylvania, we've had Baltimore,
Cecil.
we've had Delaware, DC, right?
Okay.
And so
Cecil.
Baltimore County, the nice thing there on the mobile crisis team, it is the same overarching company that runs mobile crisis in both Baltimore County and in Harford County. So
That's
that it's
great.
very easy for them to make those connections for folks.
Right. And it's a good location too, because you're, almost to Baltimore County on the bypass
Right.
Central.
up into, Pennsylvania area, things like that.
And we're close enough to the hospital that if hospital
Yes.
services are needed, we can get them there quickly. Or if somebody goes to the hospital and doesn't need to be there, they can get to the crisis center quickly. So,
Right.
we wanted to be proximate, and so not too far away, but also not like right next door.
Yes. And what a great service. It sounds like a great partnership. And we are out of time. That was
Thank you.
Thank
so
you.
quick. So thank you so much for
Thank
being
you.
here today. That's all the time for today we have. I would like to thank my guests on today's show, Rod Kornrump and Pam Llewellyn. If you would like more information on the Klein Family Harford Crisis Center, please refer to the resource page after this program. And please join us next time for another important health issue that matters the most to the citizens of Harford County. Thanks so much for watching.
You've been watching Public Health Matters, brought to you as a public service by Harford Cable Network, your county connection.